Good evening. This is Melithon Payares, FNP 597, the patient for musculoskeletal pain that I will be presenting today is a 43-year-old Hispanic male who goes by the name of RV. RV presented in the clinic this week with a chief complaint that he was trying to help he's coaching his son's travel ball team. And so they had, after practice, they thought it'd be a great opportunity to bond with the children. And so the parents faced the kids and they had a kickball tournament. And he said that while he kicked the ball, he felt like a young man at that time. While he was rounding the base, he felt a pop in his right calf and he was unable to bear weight. Felt like a really bad Charlie horse that wouldn't go away. And he had to be pulled out of the game, unfortunately. History of this present illness. Like I said, RV is a 43-year-old Hispanic male. He did present at the clinic this afternoon with unilateral swelling of the medial and central posterior calf. He did report the pop in the right calf and reported initially that pain was 10 out of 10. He described the pain as stabbing and was unable to bear weight. Regarding past medical history, he has no medical problems, no medical history. He did receive the influenza vaccine this year back in October 2025. No surgical history. He's never been hospitalized, never been to the ER, and he has no known allergies. Regarding medication, he's not on any prescribed medications, and he occasionally will take over-the-counter ibuprofens, usually 200 to 400 milligrams. But since this injury, he's increased it. He's been taking 200 milligram tablets, but taking 3 to 4 every 8 hours, just kind of to help the pain. He said it's effective, but the most effective thing is when he gets off of his leg and rest. He said prior to this injury, he would use it just kind of once a month for occasional aches and pains. Familial history. His father and mother are alive. Father is 63 years old. He's pre-diabetic currently, no medication associated with that. Diet and lifestyle modifications manage that. The mother is 61 years old, no disease or conditions being treated. He does have two brothers, both younger. One's 39 years old with no current active disease or conditions, and same for his 35-year-old younger brother. He does have two children, one son, who was part of the kickball fiasco, 13 years old. He has no current active disease or conditions that he's being managed for. And same, he has got a daughter who's 15 years old. She's physically active and involved with no active disease or conditions. Regarding his social history, he said he's been celibate because of his religious convictions and is not currently in any not currently dating or socially involved with anybody at this time. Regarding chemical histories, non-smoker, non-drinker, never has used illicit drug use. He is a 43-year-old divorced Hispanic male. He does share currently 50-50 custody of his son and daughter, and reports that him and his ex-wife have reached a mutual agreement and are doing well as co-parenting. So there's no issues regarding custody or the home. For trade, he's an automobile mechanic and also has owned his own business for the last 10 years. He speaks that ever since the children has gotten older, he has taken his passion and invested it in his children. So on his free time, he's involved coaching his son's travel baseball team, and then he's active with his daughter, who's part of a band as well as a concert and marching band. When it came to review of systems, constitutional symptoms, no fever, chills, fatigue, night sweats. He's not trying to lose weight, no intentional weight loss. Denies diplopia, vision loss, eye pain, redness, no discharge, ears, nose, mouth, throat, everything is clear. Denies no hearing loss, tinnitus, vertigo, ear pain, no congestion, no bloody nose, no sore throat, no lesions. He denies cardiovascular-wise, no chest pain, no palpitations, no dizziness or syncope. Pulmonary, he denies cough, shortness of breath, or wheezing. GI, denies nausea, vomiting, abdominal pain, diarrhea, constipation, or any change in bowel movements. GU, he denies dysuria, urgency, nocturia, incontinence, or any type of discharge. Musculoskeletal, he does report unilateral swelling of his medial right calf. He reports sharp pain that intensifies with weight bearing. Reports decreased range of motion of lower extremity, decreased range of motion with the right foot abduction, adduction, and plantar flexion. He denies headaches for neurological, no syncope, no seizures, numbness, no general weakness except for the sight, no psychiatric history, denies depression, anxiety, mood changes. Regarding endocrine, denies heat or cold intolerance, polydipsia, polyphagia, or changes in hair or skin. Hematologic and lymphatic, no. He usually doesn't have no bruising, no issues with bleeding. Allergic, he denies seasonal allergies, asthma, eczema, rash, hives. When it comes to vital signs are within normal limits. Temperature was 98.3, heart rate 75, blood pressure 124/66. Respiration 16, and O2 sats 100%. Pain in clinic is 8 out of 10. He's 5'9", weighs 165, and BMI is 24.4. He's in a healthy range. Regarding the physical exam, he's 43 years old, presents with impaired mobility related to right lower extremity injury. GCS 15, head is normal cephalic with no elevations or bruising. He's alert and oriented ×4. Face is thin. During his visit, pain was reported at 8 to 10, which worsens when he bears weight on his right lower extremity. The pain decreased with rest and limb elevation, and he does have some localized ecchymosis, dark purple in color, has some tenderness to the medial and central posterior calf, which fades and resolves at the Achilles. He had a negative Thompson test. Regarding differentials, right calf muscle tear would be the first, and then second differential would be ruptured Achilles tendon, ruptured Baker's cyst, and it's important as a red flag because of the positioning of the injury to monitor for DVT. So the plan going forward initially is conservative. Want to focus on keeping the muscle protected. So we provided a walking boot and some crutches. The crutches and the walking boot will provide the support for early and safe mobility. I educated on rest, ice compression, and elevation. For second level of pain control, I ordered some ibuprofen 600 milligrams to be used every 8 hours as needed. We did order a MRI of the right calf and ankle just to focus in on our diagnosis. He was educated on signs and symptoms of DVT and instructed to notify us if any new or worsening symptoms came about. Physical therapy was already put in place, and upon review of the MRI will be scheduled. We have a follow-up for 1 week or sooner, depending on when we get the MRI results, and he agreed to be updated by phone. I thank you for your involvement and feedback on this. Have a great day.